I am Matthew Myro, and this is the Edge of Cannabis Medicine podcast. And today's guest is Steve Bate. Steve spent most of his career in information technology and real estate. However, with a terminal cancer diagnosis, he began using cannabis oil and survived a diagnosis that no one else has survived. He actively works on local, state, federal, and international levels for the awareness of cannabis benefits. Steve, thank you so much for being on the show. Welcome.
Matthew, it's good to hear you. It's good to see you, and it's really good to be on the show. So I really appreciate that.
Yeah, great to have you here in good enough health to be able to do it. It's a pleasure.
Well, the health ride has been quite interesting, and I'd love to get into that and talk about actually the benefits of cannabis and trying to understand the endocannabinoid system, which is a science that we really haven't delved into as we should medicinally, and that's one of the things that I had to do personally, and one of the reasons I'm here as far as trying to gain that knowledge, understand that knowledge, and apply it. And also what we've done at ComCan with my partner, Dr. Mitchell Davis and Al Schulman. And Dr. Davis is probably one of the top, I'd say, 5 cannabis doctors in the country at this point, based on what we've experienced and how we've experienced with well over 1,000 true medicinal cannabis patients, with the average age being close to 70 years old.
Yeah, well, let's get into that a little bit later. First, I would just, if you could share your story with cancer and how you found this amazing survival with cannabis oil.
Well, that's real interesting. It's only been 3 years. Actually, 3 years ago this month, I was diagnosed with 2 stage 4 advanced terminal cancers, mantle cell lymphoma, as well as non-Hodgkin small B cell lymphoma, which was diagnosed at 39% of my bone marrow. So I was at the point where you'd have catastrophic failure of an organ. My spleen was so massively swollen, and there really wasn't a lot that they could do. As a matter of fact, I was told I was not treatable. They wanted to put me in an experimental program. Now, having done research on cancer and survival, on what really is the survival, both of my brothers had also had lymphoma. 8 years earlier, I did a bone marrow transplant for my brother Stan at Johns Hopkins, and knowing what the chemotherapy did for him, and my oldest brother, who's gone through 3 chemotherapies and a stem cell transplant for lymphoma also. So here's 3 brothers that had lymphoma. And going back to when the bone marrow transplant was going to be done at Johns Hopkins, I went up for my first hematological visit, as far as looking at my blood and checking on matches. And I said to them, before they took any blood, I said, "Aren't you one of the top research facilities in the world? My 2 older brothers have a rare form of lymphoma that seems to be growing." And you got we're talking 10 years ago, and lymphoma was a very quick growing cancer. So here's 2 older brothers, 8 and 12 years older than me, that had this rare form of lymphoma. So I said, before we start this to evaluate doing the bone marrow transplant for my brother, wouldn't you want to know if either I'm going to get it or I'm not going to get it, based on the fact that you have 3 brothers, 2 of which have this, and a third, which is myself, who are still alive? We can do research. So lo and behold, the head of research comes down and says, we've done a lot on breast, we've done a lot on lung cancer, we've done a lot on prostate. We really haven't done much on lymphoma. So, instead of taking, 6 units of blood, they took 12 or 15, to send all over the place. So I did become a porcupine, so I kind of enlisted for that. But at the same time, what was quite interesting is seeing how the chemotherapy was treated. It was really taking away the cancer, or destroying you pretty much, and not putting anything back. So what I realized before I went into a chemotherapy that was, probably not expected survival, but even more than that, hey, if I'm going to survive, I want to have a good life. I don't want to be a vegetable. I don't want to just barely survive. I want to have a quality of life. So the other part of getting chemotherapy seemed that the first thing that the patients would experience was like metal dripping off their teeth. It had this metal taste that not only would have first you're going to get nauseous. It's going to ruin your taste buds probably forever. And you're going to have that taste. You're never really going to want food or enjoy food. And this isn't something that's really talked a lot about. It's more the disease itself, or, the chemotherapy that would probably kill you more than the disease, statistically. So I realized I needed to be able to want food, to have a balanced body where, I could get nutrition. Because if I didn't get nutrition, there's nothing I could do. And that's how I looked at it. So I literally, I went to the physician that was going to give me the chemo. And he's like, look, you see 5 oncologists. They'll give you 6 opinions because there's really nothing, we could say that's been done that's worked. And, I went through an extensive R-CHOP therapy. It was 12 hours of chemo, and the regimens were extremely intense. But I started taking the Rick Simpson's oil, or the full extract cannabis oil that actually Rick Simpson had taught someone that how to do this years ago, and they'd had many, many patients that had used their strain and their particular extract. And so I started that before the chemotherapy. And lo and behold, it was funny, as I told the doctor, I said, I want to use some cannabis therapy during this. And he looks at me and goes, well, I don't agree with smoking during, the chemo because, how it might affect your lungs. I said, well, I'm not talking about smoking. I'm talking about taking an extract in a gelatin capsule and, having getting my blood levels up to a point where, I think it could be beneficial getting through the chemotherapy and for survival. Well, I went into chemotherapy hungry.
Yeah.
I was not nauseous. I was, I walked in there. First of all, it's a good, you're very depressed when you're told you're terminal and nothing can be done. But you can't say that the cannabis isn't a nice mood enhancer as far as if you feel more pleasurable, because usually if you're hungry and you want food, you feel more pleasurable. And, so I would come into the chemotherapy, as positive as anybody, and attitude is, a huge part of that. So yeah, if you're down and you're depressed, you don't have any mood enhancement, how do you have a good attitude? And, when you're happy and you have a good attitude, you want to go out and have a nice meal, right? You want to enjoy the quality of life. And to me, quality of life is eating nice, tasting great food, enjoying it with friends, communicating. So I literally get into the chemotherapy hungry from the Rick Simpson's oil. And they tell me that there is a menu that they give cancer patients if they could, but nobody uses it because part of the hospital where I was had a hotel with room service, and they'll deliver free food, room service to the cancer patients that are getting chemo. So I said, okay, great, give me the menu. And I ordered like everything on the menu. And they said, well, you can only order for yourself, not all the people that are there. I said, I'm sitting in this room by myself getting chemo. That's what I want. They asked if I could take one of the entrees off, which they said you could take off the hard-cooked egg. I said, a hard-boiled egg's an entree? Well, for anybody in your shape, yes, that would be an entree. And, it was, the best outcome you could possibly have. I know when I finished that chemo, the person that was the infusionist, she said, nobody's ever been diagnosed with what you were diagnosed, anytime, anywhere. endure what you endured and walked out alive. And I looked at her and I said, yes, and with a smile. And, that was pretty much, what I went through as far as the chemo and did some maintenance for toxins. And that brings us up, closer in time. My diagnosis was only 3 years ago. So this is quite recent.
And so are you totally free of the cancer at this point?
Well, on March 9th of 2020, the PET scan showed no cancer.
Well, I'm extremely grateful that you're healthy and that you're able to be on the show, and been looking forward to it for quite some time. So,
well, thank you. Hey, well, now is the time. So let's take this day one forward, right?
Absolutely, absolutely. Well, thank you so much, Steve, and we'll just keep praying for your continued betterment.
Well, I'll be all right if I can, help others. And hey, we're in Delray Beach, Florida, at ComCan, and I really pride Dr. Davis on what he's done and where we are, in the last few years, and in our own, testimonials and through patients and real medicine. So
yeah, I'll make sure to
appreciate it, Matthew.
I'll make sure to link to the ComCan website in the show notes. So if there's any folks listening to this in Florida, they can come check you out there.
Send them the Zoom.
Yeah.
Send them the Zoom. All right. It's okay. I like it. Okay. Right. I really appreciate it. Thanks so much. Have a great day. And everybody out there, hey, just keep up the attitude. We're all here together. So thanks again for everything. It's good to be here.
Good to have you.
Take care, Matthew.
Thank you.
All right. See you soon. Bye-bye. Shalom.